Hello everyone, this is Mrs. Mouna, Assistant Professor in the Research Center of Home Science, Fatima College, Madurai. I am going to give you some inputs about the functional foods and nutraceuticals in the management of cardiovascular disease. Yes, cardiovascular disease is a global public health problem. Yes, it is an abnormal function of the heart as are the blood vessels. The inclusion of functional foods are the bioactive components which is present in the functional food in our daily diet be very useful for the prevention and the treatment of the chronic diseases. Yes. Now we are going to concentrate on the role of functional foods in the management of CVD. Is the adaptation of a diet which is rich in various kinds of functional foods includes fruits and vegetables. It includes greens, soy products, pomegranate, cranberries, garlic, tomatoes, grapes. Apart from these foods, we have whole grains, flax seeds, nuts, fish, oil. Beverages include both coffee and tea. Fortified foods as well as foods which are enriched with phytosterols, vitamins, minerals and antioxidants may play a major role in the prevention of cardiovascular disease as well as the atherosclerotic plaque formation. Yes, always there is a relationship between the intake of fruits and vegetables and risk of CVD. If the person's diet is low in fruits and vegetables, there is a higher risk of cardiovascular disease. While the higher intake of fruits and vegetables related to the lower risk of cardiovascular disease. Fruits and vegetables are rich sources of polyphenolic compounds such as phenolic acid and flavonoids. Various studies have shown that the properties of flavonoids such as antioxidant property and anti-inflammatory property have the beneficial effect on the cardiovascular system. Take off the fruits and vegetables CVD by decreasing the vulnerability of the low density lipoprotein particles. That is, the oxidation process of the LDL is decreased by the inclusion of the fruits and vegetables because of the antioxidant property and the anti-inflammatory property of the functional foods. So fruits which are rich in antioxidants a significant role in the prevention of atherosclerotic processes, including the prevention of LDL oxidation, improvement of the endothelial function and the prevention of platelet aggregation. Next is about the whole grains. Yes, fiber as well as the phytochemical components which are present in the whole grains are more beneficial in the decreases the risk of cardiovascular diseases. The preventive effect of the whole grains, the risk of CVD is attributed by insulin vulnerability, by reduces the blood pressure, reducing the inflammation which is associated with the consumption of antioxidant rich foods like whole grains. Next is about the legumes. Legumes are also rich sources of protein, soluble fiber and micronutrients such as folate and polyphenols, antioxidants. So the different bioactive components like polyphenols and other phenolic components along with the fiber and protein the beneficial role in the lowering the effect of cholesterol in the blood. Nuts. Nuts are the rich sources of mono as well as the polyunsaturated fatty acid. Apart from that, arginine, soluble fiber and the antioxidant polyphenols are also present in the nuts, have the cholesterol lowering effect. Fish. Yes, as we all know, fish is a rich sources of omega-3 fatty acids. They helpful for the in the incidence of CVD. Omega-3 fatty acids, it includes docosahexaenoic acid, that is DHA, as well as the EPA, that is eicosapentaenoic acid, will form of rich which are available in, especially in the oil fish like salmon, tuna, and other fish oils. So the consumption of fish is also associated with the lower the risk of myocardial infarction, which is associated with the influence of EPA and DHA. So it can have the capacity to modulate the endothelial function. Fish oil supplements will also beneficial on the terms of the blood pressure as well as the to maintain the lipid profile. Next is about soy and soy products. Soy protein is beneficial in the lowering the effect of cholesterol in the blood. Soy products are rich in polyunsaturated fatty acids, dietary fiber, micronutrients, and low in saturated fat content and the bioactive component isoflavones. Yes, isoflavones prevent the oxidation of LDL and reduces the risk of atherosclerosis. Most of these studies, especially the study which is done in Japan, among the women, stated that daily consumption of 6 gram of soy products reduces the risk of density lipoprotein and the total cholesterol. Also, the ischemic heart disease as well as the cerebrovascular incidents when compared with the less consumption, that is a 0.5 gram of daily soy products in the diet of the group. So compared with the less consumption, if the soy products intake more, that is around 6 gram of daily consumption of the soy products, will have the beneficial effects on lowering the LDL cholesterol and the total cholesterol and maintain the other lipid profile. Next is about the coffee. Coffee and tea, these are the most only consumed beverages after the water. It has the nutraceutical components like diterpenes. It includes schwal as well as the kefirstol, which are the most beneficial bioactive components useful for the cardioprotective benefits. Next is tea. The consumption of tea is also helpful to protect the health, and the green tea contains the polyphenols named as catechins. Particularly different forms of catechins are there, that is it includes epicatechin, epigallocatechin, epicatechin gallate, epigallocatechin gallate, epigallocatechin 3 gallate. These are the different kinds of catechins which are present in the green tea, will be most effective in the profile. High intake of tea along with the skim milk consumption contribute the primary prevention of the ischemic heart disease and reduces the risk of especially the mortality rate of the cardiovascular disease. Next is the dairy products, especially the skim milk or the yogurt consumption may decreases the plasma cholesterol level. In one study done that adolescent girls who consumed even 2 liters of skim milk per day for 3 weeks increases the plasma cholesterol level when compared with the full cream consumption or the other milk products like yogurt by 8%. In another study they have done the normocholesterolemic subjects, that is the daily intake of 200 ml of yogurt which is prepared from the skim milk, and also it was fermented with the Enterococcus faecium and Streptococcus thermophilus, decreased the LDL cholesterol level by 10%. So the inclusion of probiotic foods products like yogurts or other fermented milks may contribute the improvement in the CVD biomarkers. First is about the dietary fiber. Inclusion of the dietary fiber, apples and the citrus fruits and the beta glucans from oats and other bar products have the effect on the reduction of serum LDL cholesterol. This is the dietary fiber may decrease the CVD risk by reducing the serum lipid cholesterol, blood pressure as well as the inflammation. The last is about antioxidants. Antioxidants play a major role in the prevention of CVD. Always there is an inverse relationship between the consumption of foods which are rich in antioxidants as well as the cardiovascular risk. Yes, inclusion of functional foods which is rich in antioxidants, antioxidant vitamins like vitamin A, vitamin E, vitamin C, selenium and polyphenols are associated with the reduced risk of cardiovascular diseases. Yes, of course, antioxidants play a significant role in the reduction of atherosclerotic processes and the maintenance of the lipid profiles. So, from that I am going to conclude that there is a major role and the potential health benefits between the functional foods and nutraceuticals as well as the management of CVD. Thank you for your patient listening. We'll meet you in the next video. Bye bye.